Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of the snake venom. The bitten area, skin, and subcutaneous tissue are dissected and they are subjected to three tests: radioimmunoassay, enzyme immunoassay, and enzyme linked immunosorbent assay. Radioactive immunoassay is the most sensitive and specific test. Enzyme immunoassay is the most common test, and ELISA will detect the venom, or nature of the venom is detected by ELISA.
thank you and thank you for watching.